Hi, I'm Dr. Ron Miller of CashBasedPhysicalTherapy.org. I'm starting a new series called Something to Think About. And what I want to talk about today is salary. So if you're a new grad and you just started in an outpatient physical therapy setting and you're making $35 an hour, say you have a couple years experience, maybe you're making $35, $40 an hour, or say you're an experienced vet and you're taking a management role, maybe you're getting $45 an hour. My question is this, is if you're working for like $35 an hour, seeing 2 to 3 patients every hour, okay? One, look at all the work and all the time that you're doing for $35 an hour. Better yet, if they're paying you, think like a business person or an entrepreneur. If they're paying you $35 an hour and you're seeing 2 to 3 patients an hour, ask the question this: how much money are you bringing in every hour? So there's something to think about right there. If say for instance the average reimbursement per visit is $75 an hour, if you're bringing in $150 an hour and they're only paying you $35 of that, there may be a problem with that. So this is something that you have to think about. If you're working for someone and they're paying you $40 an hour, but you're bringing in $200 every hour, there's a problem there. Maybe they should be owing you a little bit more money, or maybe that business needs to play with their overhead and kind of cut back on that, because you're bringing in a lot of money there and they're paying you only $35 an hour. This is what I'm trying to get at, of getting you think outside the box and don't just follow into the norm of healthcare and standard physical therapy practices. Think outside the box. Think of something new. So if you're bringing in $150 to $200 an hour to the company, but they're only paying you $35 an hour, there's something to use there, or at least to analyze and see if they can manage it differently. And better yet, if you're in a cash-based clinic, so say you charge $150 an hour minus your overhead. In a startup clinic, you got to keep your overhead low, so maybe your overhead's maybe like $50 to $60 a day, okay? And you see 3 patients at $150 an hour. I mean, right there, you can only work for 3 hours, make $450 minus the overhead or the expenses a day, and right there, you've only worked for 3 hours, and that's over $100 an hour. So it's time to work smarter, not harder. And this is what I want you to think about is, one, if you're working in a standard clinic, there's better options out there. Why work 8 hours seeing 2 to 3 patients an hour and getting paid for only $35 an hour when you can work smarter, not harder? Hey, maybe I could work in a cash-based clinic. I can see 3 patients at $150 an hour, work 3 hours, and make way more money right there in way less time and way less stress. So this is something to think about if you're looking into open up a cash-based clinic and you're looking at salary and how much money that you can pay yourself. Look at the differences between it. And if you find yourself being overworked and underpaid, think like an entrepreneur and not just from the other side of things where I'm just trying to make as much money as possible. Think about, okay, they're paying me $40 an hour. How much money am I bringing in per hour for them when I'm seeing 2 to 3 patients an hour? Okay, so this is just the first series of Something to Think About. I hope it gets you thinking, and thanks for tuning in.